The healing process after a facelift usually is quite quick. Patients tend to bounce back very quickly. Initially, during that first week, you will definitely have some swelling. You may have some bruising, but most of our patients don't. We use some special medications both before surgery and during surgery and after surgery that help minimize the bruising and then swelling as well. And so a lot of patients really have very little bruising, but you may have some, and typically you may have some, in the jowl area or underneath the neck. If you get a little bit of bruising, it will go away. We tell you to take it, very easy during that first 2 weeks. You will definitely have some numbness around the face. That's normal to have some numbness in the cheeks, some numbness in the neck area. That takes about 4 to 5 months for that feeling to come back. It may even take a little bit longer. And as the nerves grow back, you will feel some tingly sensation, maybe a little bit of itching sensation. Again, that's totally normal. As the nerves grow back, you may even get a little lightning bolt electrical zap as the nerves reconnect. Again, totally normal as part of the healing process. For patients that we do brow lifting on, if we do an endoscopic brow lift, these patients will definitely have some numbness on their forehead for a while. That's normal. It can take 6 months or longer for the feeling to come back up on the forehead area. It's very, very normal. If we do the incision along the hairline to actually bring the hairline down a little bit with the trichophytic brow lift, while we raise the brows, they definitely will have numbness up here, and it can take a full year for that feeling to come back. Eyelid incisions, they oftentimes will have some numbness around the eyelids for the first month or two. When you put your makeup on, you'll notice it feels a little funny. It'll be a little bit numb until that feeling comes back. But it typically comes back within about 2, maybe 3 months around the eyelids. It's pretty normal. Bruising around the eyelids, it's, again, plus minus. Some patients will get some bruising, some patients won't get any, and it just depends on the patient. If you're an easy bruiser, yes, you may get a little bruising. We did a patient just last week. I did a facelift on her, did her eyelids as well, and she didn't have a bruise on her face at all the day after surgery. So I think some patients are easy bruisers, others aren't. Again, I think we have some things at our disposal now that we did not have just even 5 years ago that really minimized the bruising and swelling on patients. And so we were able to control that a lot better than we did even just 5 years ago.